Hello, this video has been created by Dr. Marc Milia and his team in preparation for shoulder surgery, specifically related to rotator cuff repair and shoulder replacement. We created this video to help you and your family feel informed, confident, and comfortable reaching out to our team with any questions or concerns. While we do our best to educate you during your office visits, sometimes it's helpful to hear the information again at home. A rotator cuff tear typically involves a small tear in the tendon that attaches to the top of the humerus bone. The repair involves inserting sutures through tiny incisions in the skin, anchoring the tendon back to the bone using a small 4 mm plastic anchor. In shoulder replacement surgery, the damaged portions of the shoulder joint are removed and replaced with artificial components. This may involve replacing the ball, the socket, or both, depending on your individual condition. Whether you're having a standard shoulder replacement or a reverse shoulder replacement, the goals are to reduce pain, improve mobility, and restore function. Recovery protocols are similar to those of rotator cuff repair, but may vary slightly based on the procedure performed. To stay connected, we use an app called Get Well Loop. This HIPAA-compliant platform allows you to communicate with me directly and helps us check in with you daily, before and after surgery. If you haven't been enrolled yet, email us at miliama@miortho.com and Dr. Milia's assistant will get you set up. You'll receive either a text or an email, depending on your preference. Daily check-ins will prompt you to update us on your recovery and give you a secure place to ask questions. While we typically respond during the day, messages sent after 10 or 11 p.m. may not be seen until morning. It's ideal for non-urgent questions. Your procedure will be scheduled at one of two facilities, Dearborn Surgery Center across from the main Dearborn campus, or Corwell Dearborn. The slide shared with you includes all facility contact information. If you haven't received your location details, please reach out to confirm. Before surgery, it's helpful to start practicing with your non-surgical hand. If you're right-handed and having surgery on your right shoulder, begin using your left hand for daily tasks. Preparing meals in advance or asking family and friends for support can make a big difference. Many patients also find it helpful to have front-closing shirts or bras and slip-on shoes, since you'll be using only one hand for a while. Because narcotics can cause constipation, keep stool softeners like Colace or fiber supplements like Benefiber at home. For sleep, you may try melatonin or Advil PM, a combination of ibuprofen and Benadryl. These options can be safely taken with narcotics. If you prefer, you can purchase adaptive clothing, like Velcro closure shirts, online. Sleeping can be challenging after surgery. If you're sleeping in a bed, you can position your surgical arm with pillows, either on your non-surgical side or lying on your back with a wedge pillow. Some patients find a recliner more comfortable during the first few weeks. If your surgery was on the right side and your recliner has a right side handle, you may need assistance operating it. To manage pain, we perform a preoperative nerve block. This involves a small catheter delivering numbing medication for up to 3 days. Side effects can include hand numbness, hoarseness, or a droopy eyelid. If these bother you, you may remove the catheter or even pause the catheter. Just be sure to take a pain pill beforehand, as the numbness will wear off within an hour. You'll receive a contact number for the anesthesia team for catheter-related concerns. For other issues, I'll provide my direct contact information. If your surgical facility doesn't provide an ICE unit, like the Dearborn Surgery Center, you may want to purchase one online. They cost around $100. ICE can help reduce pain and the need for medication, especially after the nerve block wears off. Avoid direct skin contact. ICE should only be applied for 20 to 30 minutes at a time unless buffered by a towel. You'll receive your pain medication prescription the day of surgery. Since your arm will be numb initially, there's time to get it filled. We recommend taking a pain pill before bed, especially the first night, in case the catheter becomes dislodged during sleep. Do not drink alcohol while taking narcotics, as both are processed by the liver and can increase sedation. Avoid driving. It's illegal to operate a vehicle while on narcotics. Most narcotics contain acetaminophen Tylenol, and the safe limit is 3,000 milligrams, approximately 8 pills. in a 24-hour period. If you'd like to taper off narcotics, ibuprofen is a good alternative if you don't have kidney or gastrointestinal issues. Safe dosing is 800 milligrams every 8 hours. While blood clots after shoulder surgery are rare, we may recommend taking aspirin 325 milligrams daily for 2 weeks unless you have an allergy. Also, remove your arm from the sling 3 times a day for short pendulum exercises to promote circulation and prevent stiffness. If you have a history of clots, even many years ago, please inform us or your discharge nurse. You may begin gentle pendulum exercises the day after surgery, even if your arm is still numb. Remove the sling, let your arm dangle, and gently swing it in a small circular motion, 8 to 12 inches in each direction. Do 10 repetitions clockwise and 10 counterclockwise, 3 times daily. Let's now talk about the sling. When you receive your sling, familiarize yourself with the straps and Velcro so you can adjust it for comfort. To remove it, sit down on a bed or sofa, unclip the wrist straps and shoulder harness, and gently slide it off without moving your arm much. To move your shoulder safely, you can let it hang and swing gently. Avoid lifting your arm away from your body. When getting dressed, put your surgical arm into your shirt first. Button-down shirts are best. To reapply the sling, reverse the removal steps. Lay the sling under your arm, fasten the forearm and thumb straps, wrap the waist strap around and clip it, and then loop the neck strap over and secure it to the front clips. Adjust as needed for comfort. When it comes to your incision, leave the dressing in place for 24 hours. You'll either have a large white pad or a waterproof film over the area. You may remove the dressing after a day and begin showering after the 3rd day once the catheter is out. If you see steri strips, leave them on for up to 2 weeks. If you have sutures exposed, cover them daily with a bandage for 2 weeks. You can shower after catheter removal, letting your arm hang down and performing pendulum movements. To remove the catheter on the 3rd day, peel off the clear dressing and gently pull the catheter out. It does not usually bleed, but place a bandage over the site just in case. Keep your sling on around the house for the first month, unless we discuss otherwise during your first post-op visit. Do not drive while in your sling or taking narcotics. Return to work timing depends on your job. Office work may be possible sooner than physical labor or work that involves driving. For shoulder replacements and rotator cuff tear surgeries, heavier activities like golf or riding a bike can occur as early as 3 months. To help with constipation, start with light meals, drink plenty of fluids, and begin a stool softener like Colace twice a day, starting even before surgery. Rare but important issues to watch for include excessive redness, drainage, fever over 101 degrees Fahrenheit, or persistent numbness/weakness more than 6 hours after block removal. These are uncommon, but let us know if they occur. For urgent after-hours issues, call 313-396-0547. During business hours, first try Get Well Loop. If we do not respond within 30 minutes, contact Dr. Milia's team at 313-277-6700. Extension 314. If you prefer email, write to miliama@miortho.com. You should already have your follow-up visit scheduled, but if not, email our schedulers at scheduling@miortho.com. For true emergencies with chest pains or severe shortness of breath, vomiting, or urinary retention, go to the nearest emergency department promptly. Please don't hesitate to reach out if you need anything. I hope this information makes your recovery easier and gives you peace of mind knowing that we're here to help.